Hey, everybody, I'm Maggie, UMD, and I am a functional and holistic medicine physician actively practicing MD for the past 28 plus years. I'm dating myself. And today we are going to be exploring the topic what are some really powerful medicinal herbs? Well, curcumin. High dose curcumin is really wonderful as an anti inflammatory. Now, the other ingredient, that natural ingredient I love is think Boswellia. So I think about curcumin as more of a, people talk about, hey, I take Advil all the time. Should I take Advil or not? And the answer that I'm going to tell you is why not take Tylenol? Why not take Advil? Well, Tylenol is a liver toxin. Did you know that? And when you look at ibuprofen actually can be very damaging too. It could be very irritating to kidneys, and it can also burn a hole in your stomach. Why not do Tylenol? Why not do ibuprofen? Well, those are the reasons why. What can you do instead? Well, think about curcumin as a long-acting anti-inflammatory that it's not a kidney toxin, it's not a liver toxin, right? And then I like Boswellia because it's a immediate acting. So curcumin, more like take it every day. It's long-term. It's great as a long-term anti-inflammatory. There's all these other reasons why take curcumin in it. But Boswellia in the Move Me formula is a fast acting. So if we want to take a look at Move Me, combination, this is where I like to look at and I'd say, let's not depend on one thing as a one-trick pony. Why don't we put all the things that are needed for nerves to function better and put it into one formula? And that's what Move Me is. So what's really cool is we got curcumin, a long-acting anti-inflammatory. We got Boswellia in there, which is an instant-acting anti-inflammatory, so instant pain relief. And then what's also in there is called, it would be a protease blend. What does a protease blend mean? And this is where I'm going to talk about, we're going to take the power of natural enzymes. Okay, natural enzymes. So one of the enzymes is serrapeptase. And when you look at serrapeptase, one of the things about it is these enzymes, proteases break down protein, dead protein. When I'm dealing with nerve pain here, for example, in my neck or in my jaw right here on my face, around the nerves is a lot of damage. There's scar tissue, there's muscle and tendon that's been injured trying to heal. Sometimes there's injury in the area, scarring in the area. These nerves aren't just damaged by themselves. There's actually, whether it's autoimmune related or maybe it's related to histamines or it can be related to an injury, what we see is when there's chronic attack against nerves or damage on nerves, what forms around these nerves is scar tissue, and that's dead protein. And these dead proteins can actually trap the nerves in certain positions that cause a lot of pain. That's my case specifically. So think about this. There's nerves coming out of the back of my head, C1, C2 nerves that come out and it comes to my face. What happened in my scenario, for example, was the nerves from that position to here, not only at the root of the nerve was there damage from history of previous motor vehicle accident and trauma, but because I have underlying autoimmune issues going on, it never really healed properly, and there was continuous irritation and attack against the nerve. It was scarred and locked in all sorts of places from here to here. When there's scar tissue there, doctors will just say, you're done. It's just done. You're just going to be in pain for the rest of your life. Well, don't tell me that. I'm not going to accept that, and you shouldn't accept that. So are there natural ways to break down the scar tissue? And the answer is yes, yes, and hell yes. And that's proteases. Okay. So proteases naturally love to break down blood clots, fibrinogen. These are things that happen when there's damage, micro damage against nerves. Okay. And it loves to break down scar tissue, whether that's tendons or nerves. So if you have a process that makes these scar tissue and damage and you don't have a process that breaks it down, it is going to build up and it's going to cause problems. And when you have scar tissue around these nerves, electrical impulses cannot conduct properly. When people say I have a pinched nerve, that's a way of people saying is that there's a physical thing that's quote unquote, it's not really pinching, and it's not really per se pinching, but what it is there's a physical trauma in the area where there's pressure around this nerve, causing constant irritation, inflammation, pain signals from there. And that actually will signal a whole lot of other processes to come about. But here's the thing, as that attack and inflammation is happening, if you have nothing to break down that scar tissue, you're stuck. And it just builds up over and over again. Right? So this is why proteases are mission critical. And that's why when you're looking at Move Me, It's a combination formula where there's curcumin in there, there's Boswellia in there, and there's tons of proteases in there. It is one of the most popular formulas because it freaking works. Now, what I want to tell you about this though is that I am not a one-trick pony person because I don't think just one mechanism, one herb, that's going to do it. I want a product that's going to work, that I'm going to take advantage of the long-acting effects of curcumin, quick-acting effects of Boswellia, and the scar-breaking effects of a protease. And I'm going to tell you exactly how to take it. And I want to take advantage of them working together in 100 different mechanisms on the problem. That's why Move Me works really well. But there's a secret to how to use Move Me. And with Move Me, really importantly, is front loading the dose. Front loading, if you want to write that down. What front loading means is that, remember, we want to get the right ingredients delivered in the right medical doses all the way to the nerves at the end of your hand. So when we have, let's say someone's having a pain flare, a neuropathy flare, that's like 10 out of 10, 8 out of 10. That's a lot of inflammation. That's a lot of histamines. That's a lot of screaming cells, like a lot of scar tissue in that area that needs to get cleared out. So when you take Move Me, this is the front loading protocol. What you want to do is 4 of the Move Me twice a day. Okay, that's the front loading. Okay, 4 twice a day. And what you do is front load first couple days until you're like, I notice something is different. When you notice there's a change, that means you've hit a perfect front load dose. And then what you want to do is, as you start to notice there's the change, is when you start to go down from the front loading dose of 8 down to, for example, 7, 6, 5, 4. What I find is for people with chronic neuropathy, a maintenance dose to help daily anti-inflammatory and remove scar tissue would be about 4 a day. So standard dosing for Move Me would be 4 a day, but front load it with 8 a day for a couple days, maybe even a week, until you notice the difference, and then drop down and get yourself down to like whatever that maintenance dose is. It might be 6. Typical maintenance dose is around 4, right? And then if somebody says, can I use it on an intermittent basis? Can I use it for migraines? Right? Migraines is actually a form of neuropathy. Can I use it where when I get a migraine or when I get that pain flare, then I take that front load dose and I use it that way? Yes, you can also use it for what I call acute dosing. So I take it for when I feel that migraine starting. That's a great way to take Move Me, for example. And then you just drop it down when you don't need it anymore, or when you feel like you have the effect with the migraine. So Move Me is incredible because you're literally harnessing multiple formulas, the benefits of multiple herbal formulas to put it together to actually really work on the different reasons why you have nerve pain. I love that. All of you that wrote protocol,